Please watch this video prior to your virtual assessment with the Hip and Knee Rapid Access Clinic team. In this video, we're going to review some tips for improving your virtual assessment experience and also review movements you may be asked to perform as part of your virtual assessment. Tip number 1, log on 10 minutes prior to your assessment to ensure your video and microphone are working. Please use Google Chrome. Tip number 2, use a quiet space that is free of clutter and distraction. Tip number 3, dress appropriately. This would mean wearing shorts for a knee assessment. Tip number 4, ensure there is enough space to perform the physical exam movements. And tip number 5, try to familiarize yourself with the movements shown in the remainder of the video, as you may be asked to perform them as part of your virtual assessment. So the first thing we'll have you do is stand up from the chair and walk towards the camera. And then back towards the chair, this time on your toes. Now we'll have you walk forward on your heels, just trying to get a sense of your overall level of function. And then we'll have you do tandem walk. This is putting one foot in front of the other. Great. Facing the camera, we're going to examine your alignment from the front and from the side. Bend forward and touch your toes, and extend back at the waist. Now, facing the camera, we're going to have you do a squat down. Holding on to a chair or wall for balance, we're going to assess your single leg stance. First the right leg, and the left. Now, seated in the chair, we're going to assess your hip and knee range of motion. First, bring your right knee to your chest, and the left. Then rotate the right hip outward, and the left. Now cross your right foot onto your left knee. And same on the opposite side. Finally, bend your right knee under the chair and straighten out. And same on the left side. Great. Thank you for watching this video, and we look forward to your virtual assessment. Please try to prepare ahead of time by reviewing the tips in the video and also familiarizing yourself with the movements. Thank you.